I am Dr. Joey Kramer, and I am the founder and operator of Hope Upper Cervical Spine Center. Most people hear chiropractor and think of cracking necks. At Hope Upper Cervical, we don't guess, and we don't crack. We engineer a correction based upon objective data. Today, I'm showing you what the components are of the knee-chest procedure, the gold standard for restoring the link between your brain and your body. Not some other TikTok sensation, not some other ring ding. The only thing that matters in this office is objective clinical precision. The first thing that we start with is the idea of a thermal scan. This device right here is what measures the data of your neurological performance. This is responsible for creating a thermal map. The thermal imaging of your nervous system is what is used to determine when an adjustment is needed and when it is not. This is called a thermal pattern. And when that pattern is present, it confirms that your nervous system is in a state of dysautonomia. This pattern is what makes abnormal biomechanics visible on the x-rays. And what's unique about the knee-chest method is that we specifically analyze the ability of your C1 and C2 to move properly in space. And if these vertebrae do not move properly, we have our exact blueprint for exactly how and where you need to be adjusted. If there is no thermal pattern, we don't adjust. We call that a hold, and a hold is the ultimate goal. This should make perfect sense. No thermal pattern, no abnormal biomechanics. The body is healing itself. Now, when an adjustment is warranted, we use what is called the knee-chest method to deliver a precise, low-force impulse to the upper cervical spine. But the work does not end there. Immediately following the adjustment, you are taken to our post-adjustment recovery suite where you will rest in a zero-gravity environment with specific upper cervical support for about 15 to 20 minutes. This allows your nervous system to adapt and to accommodate to the change that we just made. You don't pull a cake out of the oven in 5 minutes, right? It would be pure mush. Just like post-adjustment, you don't just get up and walk out of the office. I don't rush you out the door. I give your body the space it needs to integrate the healing. That should make perfect sense. So for us, how we verify this is that when your rest period is complete, we perform a post-check with a thermal scan, looking for that clear reading that we discussed earlier. This is the restoration of a normal thermal scan, proving that the neurological dysautonomia or interference is gone before you walk out of our office. Precision is the difference between temporary relief and a permanent life change. In the next video, I'll walk you through the path to 100%. I'm Dr. Joey Kramer. This is the Hope Standard. This is the way.